In this video we'll explain symptoms of zinc deficiency, 8 different types of zinc supplementation, natural sources of consuming zinc. Low zinc levels, also known as zinc deficiency, can lead to a range of symptoms and health problems. The severity of these symptoms can vary from mild to severe, and they may develop gradually over time. Common signs and symptoms of zinc deficiency include impaired immune function, a weakened immune system, leading to increased susceptibility to infections and illnesses. Loss of appetite, a reduced desire to eat, which can contribute to weight loss and nutritional deficiencies. Growth retardation, zinc deficiency in children can impair growth and development. Skin issues, skin problems such as dermatitis, skin inflammation, and poor wound healing. Hair loss, thinning hair and increased hair shedding. Altered taste and smell. Changes in the ability to taste and smell, often resulting in a metallic taste in the mouth. Digestive problems, gastrointestinal symptoms like diarrhea and poor absorption of nutrients. Fatigue and weakness, generalized weakness, fatigue, and reduced energy levels. Poor cognitive function, cognitive symptoms, including difficulty concentrating, memory problems, and mental fog. Hormonal imbalances. Zinc is essential for regulating various hormones, and a deficiency can disrupt hormonal balance. Reduced fertility. Zinc deficiency can impact reproductive health, affecting both male and female fertility. Eye and vision problems. In severe cases, zinc deficiency can lead to vision problems, including night blindness. Behavioral changes. Some studies suggest that low zinc levels might be associated with mood disorders, such as depression and anxiety. It's important to note that the severity of these symptoms can vary depending on the extent of the deficiency and individual differences. If you suspect you have a zinc deficiency or are experiencing these symptoms, it's essential to consult with a healthcare professional for proper diagnosis and treatment. Why it is important to be sufficient in zinc. Testosterone production. Zinc is known to be a key component in the synthesis of testosterone, the primary male sex hormone. It's involved in the conversion of cholesterol into testosterone and helps maintain healthy testosterone levels. Low zinc levels in the body can lead to reduced testosterone production, potentially impacting muscle growth and overall vitality. Muscle growth and recovery. Adequate testosterone levels are vital for muscle growth and recovery, making zinc's role in testosterone production significant for those engaged in training and physical activity. Zinc deficiency can lead to decreased muscle strength and endurance. Immune system support. Zinc is essential for a well-functioning immune system. Engaging in intense physical training can temporarily suppress the immune system. Adequate zinc intake can help maintain immune function and reduce the risk of illness, which is essential for overall well-being and consistent training. Fighting infections, it helps the body fight off infections. People who don't have enough zinc in their body may be at greater risk of infections. Cognitive function. Zinc is necessary for proper brain function and cognitive performance. Cognitive well-being can be important for maintaining focus and motivation during training. Hormone regulation. Zinc also helps regulate other hormones beyond testosterone, including insulin, thyroid hormones, and growth hormone. 1. These hormones play critical roles in metabolism, energy levels, and overall health. Wound healing. 1. Zinc is involved in the process of wound healing and tissue repair. 1. For athletes and individuals engaged in training, this can help recover from injuries more effectively and maintain overall physical well-being. Testing for zinc deficiency involves various methods to assess your zinc status. If you suspect a zinc deficiency or want to ensure you have enough zinc in your diet, consider the following approaches. Symptoms and medical history. Start by discussing your symptoms and medical history with a healthcare professional. Symptoms of zinc deficiency may include poor wound healing, hair loss, loss of appetite, and altered taste or smell. Your medical history, dietary habits, and lifestyle can provide valuable information. Dietary assessment. Keep a food diary to record your daily intake of zinc-rich foods. This can help you and your healthcare provider understand your dietary zinc intake. Common sources of dietary zinc include meat, seafood, nuts, seeds, dairy products, and whole grains. Blood test. A blood test to measure serum zinc levels can provide a general indication of your zinc status. However, zinc levels in the blood can fluctuate throughout the day and may not accurately represent long-term zinc status. Normal serum zinc levels generally range from 70,120 micrograms per mcg per deciliter. Hair mineral analysis. Hair samples can be analyzed to assess long-term zinc levels. While hair analysis can provide insights into mineral imbalances, it's not the most accurate method for diagnosing zinc deficiency. Zinc taste test. Some healthcare professionals use a zinc taste test as a quick, qualitative assessment of zinc status. A zinc sulfate solution is taken orally, and the taste response is observed. However, this test is not highly accurate and may not be used as a definitive diagnostic tool. Increasing your zinc levels can be achieved through dietary changes, supplements, or a combination of both. Here are several strategies to boost your zinc intake. If you're a vegetarian and want to increase your zinc intake, there are several plant-based sources of zinc that you can incorporate into your diet. Here are some of the best vegetarian sources of zinc. Legumes. 1. Lentils. Lentils are an excellent source of zinc and can be used in soups, stews, and salads. 2. Chickpeas. Chickpeas, also known as garbanzo beans, are rich in zinc and are used in dishes like hummus and curries. 3. Black beans. Black beans are another legume high in zinc and are commonly used in Mexican and South American cuisine. Nuts and seeds. 1. Pumpkin seeds, pepitas. These seeds are among the best plant-based sources of zinc. They can be eaten as a snack or added to salads, oatmeal, or baked goods. 2. Sesame seeds. Sesame seeds are another good source of zinc and can be used in various dishes, including tahini, a paste used in hummus and dressings. 3. Hemp seeds. Hemp seeds are not only rich in zinc but also provide a good balance of omega-3 and omega-6 fatty acids. 4. Whole grains. Quinoa. Quinoa is a nutritious grain that contains zinc and can be used as a base for salads, side dishes, or breakfast bowls. 2. Oats. Oats are a source of zinc and can be eaten as oatmeal or used in baking. Dairy and dairy alternatives. Yogurt. Greek yogurt and fortified dairy-free yogurts can provide a moderate amount of zinc. Cheese. Some types of cheese contain zinc, but it's essential to check labels as zinc content can vary. Vegetables. 1. Mushrooms. Some varieties of mushrooms, such as shiitake and white button mushrooms, contain zinc. 2. Spinach. Spinach is a leafy green with a modest amount of zinc. 3. Eggs. If you include eggs in your vegetarian diet, they can contribute to your zinc intake, particularly the yolk. Fortified foods. Some plant-based foods, like breakfast cereals, are fortified with zinc. Check food labels to identify fortified options. While these vegetarian sources of zinc are valuable, it's important to note that some plant-based foods, especially grains and legumes, also contain compounds called phytates that can inhibit zinc absorption. To maximize zinc absorption from these foods, consider soaking, sprouting, or fermenting them before consumption. Non-vegetarian. Dietary sources. Consume foods that are rich in zinc. Some of the best dietary sources of zinc include 1. Meat. Beef and lamb are high in zinc, with beef being one of the best sources. 2. Seafood. Oysters, crab, lobster, and shrimp are excellent sources of zinc. 3. Poultry. Chicken and turkey also provide zinc, although in slightly lower amounts than red meat and seafood. 4. Dairy products. Dairy foods like cheese and yogurt contain zinc. 5. Nuts and seeds. Pumpkin seeds, pepitas, sunflower seeds, and various nuts like almonds and cashews are good sources. 6. Legumes. Beans, e.g., chickpeas, lentils, and black beans, and whole grains, e.g., oats and quinoa, contain zinc, though they also contain phytates, which can hinder zinc absorption. 7. Eggs. 8. Vegetables. There are various types of zinc supplementation available, each with its own characteristics and potential benefits. The choice of zinc supplement can depend on factors like absorption rate, tolerability, and specific health needs. Here are some common types of zinc supplements and their potential benefits. Zinc gluconate. 1. Benefits. This form of zinc is well tolerated and is commonly used in over-the-counter supplements and lozenges. It is relatively easy on the stomach. When to consider: zinc gluconate is a good choice if you need a general zinc supplement or if you want to use zinc to support immune health. Zinc citrate. Benefits: zinc citrate is well absorbed by the body and is generally well tolerated. It's a common form used in dietary supplements. When to consider: it's a good option for general zinc supplementation to maintain overall health. Zinc picolinate. Benefits: zinc picolinate is another well-absorbed form of zinc and is considered a good choice for increasing zinc levels in the body. When to consider: this form is often used for general zinc supplementation or to address specific health concerns related to zinc deficiency. Zinc sulfate. Benefits: zinc sulfate is a more affordable form of zinc and is used in some medicinal applications, such as treating zinc deficiency and skin conditions. When to consider: it may be prescribed by a healthcare provider for specific medical conditions, but it's less common for general supplementation due to its potential for stomach upset. Zinc orotate. Benefits: zinc orotate is a form that combines zinc with orotic acid, which may enhance zinc absorption. It is sometimes used to support overall health. When to consider: consider zinc orotate if you are looking for a potentially more bioavailable form of zinc for general supplementation. Chelated zinc. Benefits: chelated forms of zinc, such as zinc amino acid chelates, are designed to improve zinc absorption. They are less likely to cause gastrointestinal discomfort. When to consider: chelated zinc is a good option if you have a sensitive stomach and want to maximize zinc absorption. Zinc L-methionine. Benefits: this form combines zinc with the amino acid methionine, potentially increasing bioavailability. When to consider: consider zinc L-methionine if you are looking for a well-absorbed form of zinc that may have enhanced benefits. Zinc acetate. Benefits: zinc acetate is sometimes used in lozenges for immune support, as it is well tolerated by the mouth and throat. When to consider: it is a good choice if you want to use zinc to support immune health, particularly when dealing with colds or sore throats. The choice of zinc supplements should be based on your specific needs and any recommendations from a healthcare provider or a registered dietitian. It's important to follow the recommended dosage and not exceed the tolerable upper intake level, for zinc, as excessive zinc intake can lead to adverse effects. The American Academy of Family Physicians, AAFP, recommends a daily intake of 8 to 11 mg of elemental zinc for adults, depending on sex. The recommended daily zinc intake for an adult woman in the UK is 7 mg. The recommended daily zinc intake for an adult man in the UK is 9.5 mg.